Dr. Mui from Mui Chiropractic and Sports Medicine. I'm going to tell you about Graston Technique today. Graston Technique actually works with a lot of my sports injury patients. When we look at sports injuries, we're actually looking at how tissue kind of correlates with the actual patient and actually how they function. So when we look at this, you can actually use my gloves as an example. So when we're looking at myofascia, which is an encasing of the muscle, which is essentially like my glove, as we look at this, my hand, which is essentially the muscle, is actually encased by the myofascia. And when we have normal movement, the tissue actually glides like this. Okay? What happens is when you have some type of injury, the tissue itself becomes, becomes deranged. The tissue is either torn, and the body tries to repair it by actually adding a lot of collagen fibers onto the damaged portions. When this happens, the tissue kind of looks like a glove. It actually turns into something like this. It becomes very convoluted. Okay, so when we have normal movement, it actually kind of binds on each other, so it doesn't really move correctly. So when we look at this from a clinical aspect, a lot of patients will come in saying, "Oh, we have a lot of neck pain," and when you palpate around, there's a lot of pain in the area, and there's actually like a rope that kind of comes down there. Okay, when we use the Graston tool, which actually looks like this, we're actually taking the bevel that's on the tool, and we're actually hooking into the myofascial layer and actually breaking through that scar tissue. So essentially what we're trying to do is we're trying to remodel the tissue so that it actually glides a little smoother. Okay. What we're going to do now is I'm going to actually demonstrate a little bit of the Graston work on my good friend Kevin over here. And we're going to use a little bit of emollient. Okay. So the emollient's actually designed to kind of protect the skin, so we're not taking any type of skin off or anything like that. So what we're going to do is we're going to work on his trapezius, especially his right one right now. So what I do is I usually stretch the tissue as much as I can, and we're going to apply a little bit of the emollient right onto the tissue itself, just like this. And then we're just going to go with the line of the tissue. So the the fibers actually run this way, like that. Okay? So we're going to take it, and we're actually just going to elongate it, and then we're just going to work it like this. It's usually very gentle. There shouldn't be any type of bruising associated with the treatment. And what I'm feeling for are those bumps and ridges, like the ones I showed you on the actual glove. And we're actually trying to break that apart. And as you can see, it's actually turning a little red. I'm using very light pressure. And there we go. And as you can see, this is the line that we treated. Okay, and usually this redness will actually disappear within a couple hours, and you should feel a little better.